Everyone Included is a vision for the future of healthcare based on a framework of mutual respect and inclusivity. We believe everyone should be respected for the expertise they can bring to discussions about the future of healthcare. Here are some of our stories.
Hugo, you and I had this conversation when we were at the White House. We were talking about power and what is power, because I wonder if power is different for you. What does power mean, even?
I think what we talked about was having power is a matter of having choices, and so if you have a lot of choices, the more choices that you have available to you, the more power you have.
So is that right? Is that right?
I don't know.
Well, so
interesting.
I think if you ask 10 people, you'll get 10 different answers.
I agree. You were saying earlier about Obama going, I own my data, and what a big deal it was. Well, power is at the heart of that.
Because the data is a resource that you can turn into a solution for yourself if you have access to the data.
So patients who don't have access to the data are disempowered. Some people are offended by this notion of patient empowerment. Folks kind of think that patient empowerment may mean someone else's disempowerment. In order for patients to be empowered, well, is that true? I don't believe that's true.
I don't like the term patient empowerment because I think it brings us back to this framework of power being what defines the relationships in healthcare. And we don't have to define the provider-patient relationship in terms of power, but we do. And I think what we've kind of tried to say with Everyone Included and with Medicine X is that there has been this historic linking of power and respect in healthcare, where if you have power, then you are accorded respect because someone decided to give you power, so you must have knowledge and I must respect that.
It's an issue of perspective. If you start to talk about empowered patients and engaged patients, you're looking at it from a different direction. If you talk about patient empowerment and patient engagement, it's a very paternalistic term.
It is paternalistic.
But if you change those terms into adjectives for the patient, they're no longer paternalistic. In both terms, there is something fundamentally missing. The power means nothing if the person cannot make choices, the decisions.
We've created this term e-patient, and it's gone around that it's come out, and it's that's associated with the empowered patient, and I think it's changed the dynamic, and actually not always for the better, because actually not every patient wants power. The term has actually created a power dynamic.
Well, what if E is for expert?
Yeah.
And what we talk about is respect hierarchies that respect the people in healthcare for the expertise that they bring. And we don't do that right now.
So at the core of the doctor-patient relationship, there has to be trust. What power comes into play is when there's no trust. The gradual loss of trust is what has created the e-patient. The e-patient has also appeared because of the social web. People were able to communicate and talk to one another, but they would not have talked to one another if there was no need.
I don't know if the underlying problem is that we don't have true mutual respect for each other. Because I don't know if you can even trust someone you don't respect. And at the end of the day, I think for me, when you talk about building trust, it starts really with me knowing that someone respects me. And you've seen this at Medicine X, the power of sharing stories and showing your own vulnerability. If you show your vulnerability to someone else, that transforms the other person because you're showing them that you do respect them enough to share something really close and important to you, and that they would respect you enough to value what you're saying. And I think that's where you start to build, at least for me. If I don't see those cues in my interactions, it's hard for me to build trust.
So I'm not sure that you need to have respect to
build trust, but I'm absolutely sure that if there is a lack of respect, you'll destroy any trust that exists.
Yeah, I agree.
One of the best examples I've seen from at the hospital that I volunteer at, I'm on the oncology floor. I don't know if you can speak to this afterwards too from a nurse's perspective, so from the kids I've seen when they're like new patients and they've yet to meet their doctors, that they've just been admitted, and the only people they've interacted with are their nurses and volunteers. And they're very nervous. They've only interacted with people who would be considered low level on this totem pole per se of the power hierarchy. And then they meet their doctors, who would be the clinicians who are the highest up on this totem pole. I see these patients for months and months of time while they're still there. They only see the physician for maybe 10, 15 minutes at a time. Once a week, twice a week at most. But the nurses are the people who are there every day for, hours at a time. They're seeing them all day, every day, pretty much going in and out. And it's the nurses who really are able to build that mutual respect with patients by sharing details of their lives. Like, oh, I have a dog too. You have a dog at home. I see you have this picture on the wall of your dog. Something that helps to build that respect is by showing I'm a human. I'm not this doctor and you're not this patient. We're both just people who have these things in common.
And I want to know if doctors are more respected than nurses, or if nurses are more respected than doctors.
Nursing is a strange thing where you have to very quickly develop a trusting relationship with somebody while they're in this foreign environment and scary things are happening, and you want to, have a relationship where you can communicate with them and hear what they're saying. So whenever I go in and I see a patient, I always ask them to tell me their story, how they got here, and then you learn all kinds of things. You learn how you might relate to them. My dad had AFib, so he was in the hospital, and I work on a cardiac floor, so I talk about that with patients, or sometimes you talk to them and you learn things that you wouldn't have figured out unless you had asked. And so I find it so important to be able to go in and establish a trust and be able to say, I'm here to help you with your needs, and I want to do that the best that I can. So you're the expert in how you feel. Tell me how you feel, and we'll work together in this.
What's an instance when you have no respect for a patient?
Sometimes you get patients who come in and they have no interest in taking care of themselves. And some of them blatantly will say, I'm just here for you to fix me up, and I'll see you probably in a month because I'm not going to change. And I think you really just have to, as much as possible, keep a good, hopeful attitude. Just keep trying to educate, keep trying to meet them where they are, because everybody's at a different place.
For me, I think nurses are the most trusted relationship with patients. I think that trust comes from respect. I think that respect comes from empathy. I think because of the amount of time that nurses spend with patients, and nurses are with patients in their most vulnerable moments, and to share that experience is to have a profound empathy for the person that the physician can't have, because he or she is not there at those times or all of those times.
On the next episode of Everyone Included.
Drinking, she goes back to drugs, and the doctors are going, you as a patient can talk to her differently to how I can talk to her.
From our side, it seems like something that we see all the time. It's like, you're gonna go home tomorrow, but it made me always remember, like, this is something very important that just happened to this family, and I can't forget it.
It just goes to the sense of we need connection. Whether that's the online community, Gilles, that you created, or talking with other patients, it's that connection and that feeling felt.